I am joined by Erica DeBoer, who is Chief Nursing Officer at Sanford Health, joining us from the Becker's annual meeting in Chicago. Erica, great to see you.
Oh, great to see you too, Courtney.
You just finished leading a panel discussing how to win nursing talent and maximize that engagement. It's a trending topic in healthcare today. So, Erica, talk about the ways we're leveraging technology to improve patient outcomes and alleviate burnout.
That's a really great question. I actually was privileged to speak with a couple other nursing leaders from a couple other organizations and integrated systems at that. And so the biggest way is that Sanford Health is using technology is to help us actually work more efficiently. I think for our frontline teams, they're working so hard, but how do we make sure that they can work at the top of their license? So how do we use technology to help them be able to automate some of those workflows as well as work smarter so that they can bring that joy back to the work that they do every single day.
Throughout your leadership, Erica, you've always focused on that concept of brilliance at the bedside to provide the best care. Now, is this to say our nursing workforce is best served by allowing them to focus on their most fulfilling role of caring for patients versus those busy administrative tasks?
Absolutely. I think nursing is all about the caring spirit and the ability for us to make those connections with our patients. And so when we think about the brilliance at the bedside, when I talk about that, it's really those folks that can help us solve the big issues that we need to solve for them. So every software solution, every technology is phenomenal, but we need to make sure that it's really going to solve the problem that our frontline teams really need to have solved. And so by going to our bedside, by speaking with our frontline teams, they can help us really identify those workflows that we need to solve and what solutions might be most effective. So when we think about technology, when we think about getting rid of stupid stuff, so gross, they're the ones that can help us actually understand how to solve those problems. They've got the answers because they're living it every day.
What have we learned to be the best ways to empower our nurses to improve outcomes and alleviate some of that burnout?
I love that. So one of the main ways is through our shared governance structure. So at Sanford, obviously, all of you know about what Senate is, but it's important for us to continue to use our voice, not only through the shared governance structure in Senate, but also as part of our high reliability journey. It's very important for new eyes and new perspectives to help us learn how to really set aside some of the traditions of the things that we've always done and really be able to focus on those things that are most important to our frontline teams. So we know flexibility is really important. We also understand that our frontline teams are really tech savvy. And so how do we make sure that we're actually decreasing some of that burden by actually looking at workflows and really taking out some of those things that really don't add value so that we can continue to engage with our patients and make sure that our satisfaction of our employees is as high as it could be.
Certainly always grateful for your leadership. Erica DeBoer, Chief Nursing Officer at Sanford Health, joining us from Chicago. Erica, thank you for being here and for your time today.
Thank you so much, Courtney.
For Sanford Health News, I'm Courtney Collin.